We'll feel a little more energetic. I think that talk that Tara just did was probably my favourite talk of the afternoon. I thought it was absolutely spectacular. It was amazing. And what it's going to do is put me in a really difficult situation, because now I'm on to talk about depression, and I'm on to talk about it in a distant, medical, and so on, with none of the extraordinary language that she used, and correct language, and spectacular language, because we are trapped by the lack of words that we have. And I suppose one of the things about listening to, in the car every morning, listening to the radio, is everyone who comes on, they talk about depression. Everyone has depression. The people in the past had depression, current people have depression. And what people mean by the word depression has kind of become devalued. We don't really know what it is. And there's a phrase you learn as a student in psychology, that depression is the common cold of psychiatry. It's kind of, what is it? What is a cold? And it means something different to every person. And sometimes when we're talking about depression, we're talking about sadness. Sometimes when we're talking about depression, we're talking about this overwhelming hole in our soul. And it can kind of cover everything in between. If you go into work on a Monday morning, someone might go, I'm a bit depressed, it's Monday. They go, well, is that depression? And equally, we'll pick up the paper and we'll see some tragedy, and the cause will be given as he was depressed at the time. And so the word depression has lost all sorts of meaning. So we're going to talk a bit about it here, a little bit in terms of medically how it's thought about, or at least in terms of psychiatry, and then in terms of psychology, how do we think about it and what can we do about it. So this is what the World Health Organization describes as depression. So if you want to meet official criteria for depression, this is what the World Health Organization says. That you need more than 4 of these symptoms for longer than a month. You need depressed mood. You need an inability to feel pleasure. You need to be overly fatigued, to have an inability to concentrate, have reduced self-esteem, feelings of worthlessness or guilt, to have bleak or pessimistic view of the future, to have suicidal ideation, sleep disturbance, and a decrease or an increase in weight in a dramatic sort of way. And so you can see that this is quite profound. It's quite overwhelming. And it affects everything from the most basic biological function, our sleeping and our eating, to the most profound human function, our desire to live and our sense of self-worth and who we are. And again, we talked a little bit earlier, when we think about psychology and psychiatry, we see this thing as something biological, we see it as something psychological, and we see it as something social. And so biologically, genes matter. The genes that we have, the parents we came from, the grandparents we came from, and so on, they matter. They're really important. So I have an increased risk of heart disease because my father has an increased risk of heart disease and his father has an increased risk of heart disease, and so on. That's in my family. That's part of my genetic makeup. I know that. I'm in my mid-30s. I know that now. Hopefully it won't be too relevant till later on, but that's part of who I am. And equally, we can carry a risk for mental health difficulties. We know that neurotransmitters make a difference, that actually the things that are going on in our mind, that are firing all the time, we have 100 billion synaptic connectors in our brain. We know what's going on in between them makes a difference. And we know things like the level of energy we have, the level of sleep we have, the level of physicality we have makes a difference. We know that the thoughts and feelings and behaviours, and that's what I'm going to focus on in a few minutes, are really important. And we also know that depression exists in the world. Those first 2 bits are just about us, it's just me standing alone, but actually depression went up in Ireland when the recession happened. And that's not just because of our brain and our genes and our grandparents. That's because loads of people lost jobs, loads of people lost houses, loads of people went into negative equity, and so on. That what happened in the world, the fact that something happens on Wall Street, can have a huge effect on what's happening in our mind and in our brain. We know that if you have a divorce, you're at increased risk of depression. You know, if you have a breakup, you're at increased risk of depression. If you're grieving, you've lost a loved one, you're at increased risk of depression. If you're struggling to pay a mortgage and there's financial stress, you're at increased risk of depression. So all of these things that are broad and huge and national and international filter all the way down to what's going on between our 2 ears. And that's really important. And so there's a great point of contrast, and it's a really interesting debate between the stuff that I'm talking about here and what Tara talked about just before. Because how normal is it to be depressed? Now, it's incredibly normal to be sad. We all have sadness. It's incredibly normal to be angry. We all have anger. It's incredibly normal to be anxious and irritated and all of those sort of things. Those negative emotions that we don't like to talk about and we don't like to engage in and that we're not good at expressing are a very normal part of being human. So being happy all the time is not normal. We have periods of not being happy. But that's not the same thing as being clinically depressed. And that period of clinical depression is actually quite unusual. It happens to lots of people. It's quite, it's common in that sense. It'll happen about 10% of the population. But for 90% of the population will feel sadness, but only 10% of the population will be depressed. Certainly in the way that the WHO, the World Health Organization, would think about it. So that kind of thing where how can we hold negative emotions and think about them, and that's really important, but also see that there's something quantifiably different about how depression works. And it's about understanding depression as a continuum. That it's not one thing, it's not a category sitting off on its own. It runs all the way through society, or all the way from the happiest we are to the saddest we are. And that's very normal. It runs all the way along. But at a certain point, and it's relatively arbitrary, we say, that's where we're going to call it clinical. At that point, it becomes something that we need to intervene with, and we need to do something about. And this is sort of the stuff we'd do. We'd look at medication, we'd look at diet, we'd look at exercise to try and help the body. We'd look at personal reflection, we'd look at meditation even to help, and therapy to help the mind. And we'd look to reduce social pressure and increase social support. So I want to talk for a few minutes about this man, who's Sterling Morey. Now, Sterling Morey is alive. He's a little wizard of a man, and he works in a cancer hospital in London. And he works with people who have terminal cancer. And one of the things, he's a psychologist. And one of the things that he found is actually even in people with terminal cancer, depression isn't the norm. Most people with terminal cancer, which you would imagine is the worst possible situation to be in, we can't really imagine a worse situation to be in, don't have cancer. It's the minority of people in that situation, or don't have depression. It's the minority of people who have those experiences, have experienced depression. And what he found was different, what was going on for those people, what the depression was, then he took that model and he started to apply it across the whole country. And he found that model actually worked very well. And in the middle of it is negative beliefs about the self, the world, and others. Who I am, how other people think of me, and how the world treats me. And that leads to lots of negative thoughts. We have 60,000 thoughts a day. Our brain is an engine that creates thoughts, and that a lot of these can be negative when we believe negative things about ourselves. And the more we think it, the worse our own beliefs are. He found that a lot of it's physiological. It's physical tiredness, it's physical pain, it's physical irritability, it's physical difficulty sleeping, difficulty eating, and so on. Do people know what the word ruminate means? That they should, that they were in the countryside here. To ruminate is what cows do with grass. I would expect that from a Dublin audience. For here, I was expecting something better. Cows take it up and they chew the cud and chew the cud and chew the cud. And it's what humans do with worries. We'll take it up and we'll think about it and think about it and think about it. So if we have an exam in a week, it won't just be the 2 hours of the exam. It'll be the 168 hours of worrying about it as we lead up to the exam. And that has a hugely negative effect on how we feel. There's lots of emotion. And the key behaviour that we do is we withdraw or avoid. We do less of what we'd normally do, and we'd see less of the people we'd normally see. And then we'd often do something unhelpful. And in Ireland, that's drink, or it's drugs. But equally, there's lots of other unhelpful things we might do. And that's going to be specific to different people in different situations. And what Sterling found is that these 6 things increase your risk of depression. And if you engage in them, they increase your risk of depression. And if through therapy, you can reduce these 6 things, that depression lifts. And so a lot of CBT for depression is about trying to fix the 6 things around the outside in order to get at the piece in the middle. And so what it tries to do is to improve our negative thinking, to actually learn to ruminate a little less and worry a little less, to look at the emotions we feel, the negative emotions we feel, and find a way to express them in a healthy way so they're external and not internal, to try and withdraw a little less and avoid a little less and go back towards the things we'd normally do and the people we'd normally see, to not do the unhelpful behaviours, and then to try and work on our body in a helpful way. And so what we try and do in terms of the recovery is challenge negative thoughts, reduce rumination, experience and tolerate negative emotions, and increase the amount of positive emotions, reduce avoidance, increase positive behaviours, and try and build positive physical feelings. Now, that's a lot to do. In therapy, you just pick one of those and you'd work on it for a while, and then the next one, and the next one. And if you get a 10% change in each one, you suddenly get a huge amount of change. So you're not looking for something transformative in every area. So you're not looking for, I'm going to challenge every negative thought. I'm never going to have a negative thought again. That's not possible. But if our thoughts can be 10% more positive, if we can challenge the worst of them, the I'm not good enough, I'm not lovable, I'm not wanted, if we can challenge that one, then it's going to have a huge knock-on effect. We're always going to worry. That's part of being human. But actually, if I can spend less hours worrying and ruminating in the week, then, and more hours engaged in just normal life, that has a huge positive effect. If I'm able to talk about negative emotions, and this, I think, Tara just described it so beautifully, if I'm able to express those things, and there's someone able to pick them up, sometimes expression is writing, sometimes it's painting, sometimes it's the drum kit, and most often it's talking, that they have somewhere to go, and I'm not carrying them around inside my chest. That's really important. And if I start back doing the things I'd normally do and stop avoiding, that has a huge effect. And then we try and think physically that we are a human being, this spiritual, soulful, conscious thing in a human body, which is blood and guts and hormones and neurotransmitters, and we have to get the human body piece to work as well. So we're going to go 2 messages I want to take out of this talk on depression, and there's only 2. And the most important message is a thought is not a fact. We have 60,000 thoughts a day, and most of them aren't facts. We have thoughts about the weather, thoughts about getting here, thoughts about getting home, thoughts about the future, thoughts about the past, and they can be true, a little bit true, sometimes true, or totally nonsense. We can daydream, we can fantasize, we can be positive, we can be negative, but it doesn't mean any of those things are true. So we did this earlier, but I want you to think of one negative thought about yourself. Okay? Hold one negative thought about yourself in your mind. And most people, if you ask them, will say, oh, that's probably true. I probably am a bit like that. Now I want you to think about a positive thought. Winning the lotto. Getting a promotion, being asked out by the best looking person in the room. And most people go, no, that's nonsense. That's not true. That's not a fact. That's never going to happen. We have no problem dismissing positive thoughts as not facts, but we hold on to the negative ones. And in fact, both are true. Thoughts are just imaginings. It's just something created by our brain. There doesn't have to be a truth to it. And we're able to take them out and look at them and hold them and see, is it true some of the time? Not some of the time, what circumstances? And we're able to balance those thoughts. We can watch them come in and we can watch them go. And it's very useful to name that thought because they'll come around, they're repetitive. You go, well, that's my trapped thought, or that's my self-critical thought, or that's my I'm no good thought. And that thought will come, but it doesn't mean it's true. And in a few minutes, it'll go. And we can get on with our day without engaging it at all. I'm going to skip over that. And so here are some of the most common negative thoughts. I'm useless, I'll mess up, I'll never get a fair chance, everything is hopeless, everything is pointless. These are the thoughts that come up in depression, and they come up a lot. They're repetitive. And what we're trying to do is just balance them. That sometimes I make mistakes, but other times I do well. I mightn't be enjoying myself now, I might be going through a tough phase, but actually I have enjoyed myself in the past, and it's possible I might enjoy myself in the future. That each thought we can do on the one hand and on the other hand. And if we can hold our thoughts like that, we can have a much more balanced sense of reality, a much more balanced sense of the world, and we can feel more balanced within ourselves, rather than taking that critical thought or negative thought or pessimistic thought and running with it. I want to talk about one other useful thing to do, which is positive behaviour. So a lot of people have been talking about CBT. CBT is what I do most of the time. A lot of people talk about medication. Medication is obviously the other big treatment for depression. But both CBT, if you do a randomized control trial of the most effective intervention for depression, it's not medication and it's not CBT. It's a thing called behavioural activation, which is so simple that it's sort of forgotten. And behavioural activation is doing more. When we're depressed, we do less, and that's very understandable because we feel awful. But in fact, if you can help people gradually increase the amount they do in any given day, the recovery rates are as good as for antidepressants and as good for CBT. And so there's something really important about activity, and in particular, positive activity. So what we're trying to do is reduce avoidance, reduce the things that we've stopped doing, and start back on the things we used to do. Did we used to go to the shops? Well, let's go to the shops. Did we used to go to the gym? Let's go to the gym. Did we used to call around our friends for a cup of tea? Let's go to a cup of tea. Did we used to go out to the park? Let's go to the park. What did we used to do? And we've talked a lot about greatness, but most of these things are bread and butter. And of course, in depression, the bread and butter ends. We stop doing it. And mostly, this is about getting back to the bread and butter. And we can do it very slowly, and we can do it very compassionately, but actually getting the bread and butter back in. And most people feel they can't do it at the beginning. And it's what's the smallest possible thing I can do. And often in therapy, the smallest thing we ask people to aim for is a text. Text someone. Who haven't you texted in a while? Text them. Say hello. That's it. No big message, nothing huge. But we can find the smallest possible thing. For some people, that might be taking 2 feet out and putting them on the bed, or putting them on the floor, getting out of the bed. Some people, it might be getting as far as the shower. For some people, it might be getting as far as the garden or as far as the kitchen. If that's where the person is at, that's enough. That's great. That's the one step. For other people, it'll be going as far as the park or as far as the gym or further afield. It doesn't matter. It depends on where the person is from. But if they can increase their level of activity, just that one step, they start to improve. And so what we want to do is look for small pleasures and accomplish small tasks. The small tasks is easy because we all know what the tasks are. As human beings, we're less good at the pleasures. And so this is generally known as the Cornetto principle. And the Cornetto principle is exactly what it says on the tin, is go buy a Cornetto. Because Cornettos are nice. Not for any reason. You didn't deserve it. You didn't earn it. You don't have to climb a hurdle to get there. Just buy a Cornetto and eat the Cornetto. And tomorrow, go buy another Cornetto and eat another Cornetto. And if you don't like Cornettos, buy something else. And just do it because it's nice. You're allowed pleasure in your life. You're allowed enjoyment. That life isn't about tasks and hurdles and overcoming things all the time. We can do things that are kind and nice for ourselves and enjoyable. And the enjoyment lasts the length of, 2 minutes. Great. It's a good 2 minutes. Increasingly, there's a lot of randomized controls coming in, and it's what we've always known, but exercise is extraordinarily important. It's incredibly helpful. That's going to be different for different people. We're a huge range of people with different levels of exercise here, or different levels of fitness here. That's okay. We start at whatever the person is at. If that's the length of the garden, it's the length of the garden, great. Let's go do that. Perfect. Now, in all of this, people, the almost universal response is, I think it's a good idea, I like it, but I don't feel able to. I don't feel like doing it. And that's true. The person is depressed. You won't feel like doing it. And if you wait until you feel like doing it, it'll never happen because you're depressed. The feeling comes afterwards. You have to do the thing and then the good feeling comes. And you have to do the thing a few times. It won't probably come the first time. The activation comes first and then the motivation. You have to do it before you want to do it. And that's a terrible paradox. And it traps people for a very long time. and they're waiting to want to do it. Because they wanted to do it before. They wanted to go to work before. They wanted to go to the gym before. And you'd want to do it, and then you'd go do the thing. And in depression, it's reversed. You have to do it, and then you'll want to do it. And that's a very tough place to be. And so what we do with people, we sit down, and we draw out Monday to Sunday, and we think of some stuff to do. And we just try and increase the amount of activity that's going on. And when you do that, people learn extraordinary things about themselves. Because remember, they're rock bottom when you're doing this work. And because the person is rock bottom, they're able to see actually some truths about themselves. And they're able to see that they're able to try. They're trying extraordinarily hard because they know they're feeling awful. So anything they achieve is an extraordinary achievement. They know that they're resilient. They learn that they're strong. They learn that they're loved and that they love the people around them. And that as they take each step, as they increase their behaviour a little bit, as they drop their avoidance a little bit, that these are the things that they're able to learn about themselves and about other people and the world around them. And that's an extraordinary change in mind. And that's me, and I've run over time. I'd like to thank you very much for today. Thank you.